I want to show you now, as I finish, the home exercise program that can begin. The treatment will depend on the condition. We are not going to demonstrate all the treatment here. You do a lot of mobilization, depends on the condition. But at least for the exercise, the home exercise program, number one is to correct the posture. When to correct the posture, you start with stability. When it is still painful, you use a towel, you make a roll, especially when it is very painful, a roll. Of course, you need to teach your patient how to sleep on a pillow. That's what I'm going to do first. The pillow, it has to be soft, and the pillow need to support only the head and the neck. Never put your shoulders on the pillow. This is how the pillow is necessary. Some patients say, "Oh, I don't use a pillow, that's how I feel better." No, because lie on your side, turn and lie on your side. If you lie on your side, or you're not using a pillow, sometimes you put your arm the way you do it. You see now the neck is not straight, it's somehow compressed down there. So now it's very good to put a pillow and not the shoulder on the pillow, so that the neck can stay in neutral position. Never sleep on your stomach. It's very bad. Turn and go on your stomach. When you lie on your stomach, many people have developed a neck problem because of lying on your stomach. When you're on your stomach, your bed doesn't have this wall, so you will turn like this there. Then this torsion you are doing on the spine, it causes degeneration of this vertebra. Many people, they like to sleep that, but it's very bad. It's not bad for the lower back, but it's bad for the neck. And it comes slowly without knowing. That's what we say, the right neck. You start this position in the morning, you cannot turn it. Because you've been doing it, that's what we call a right neck. It comes insidiously without knowing, and then you cannot turn. You have to be okay. So sleeping, the best sleeping postures is on your spine or on your side, but using a pillow, not two pillows. Okay, lie on your pillow. Let's suppose that, suppose you have two pillows like this and lie on it. You see now, if you are on two pillows, you see now the head is turned now this side will be compressed. And it comes slow without knowing. Because usually the disc I showed you, during the day, it applied, many forces applied on it. They apply on it in rotation, in compression. So at night when you go to sleep, when you lie down, that's the time when they feel again with water. That's why you need to be careful to sleep. Now that this I wanted to show you how we can start to retrain these deep neck flexors. Lie on your back and move slowly down so that you can avoid this hole. Yes, there. So you can ask a patient to make a roll like this. Here, a roll. And you ask the patient to press against it with your neck. Press. You are pressing up, not let me put it properly. You see, this is too big, but usually it has to be a roll. You put it under the neck. So I want you the neck. No, the head is there. Press on the yeah. Press with the neck so that I cannot pull it. Press, and I pull 1, 2, 3, 4, 5, and relax. You can do 10. And this is what we call, you are correcting that part. It was this you are correcting. You see, you are compressing. So when patients are still having too much pain, you can start with this. Or when it's not too much, you come here on the wall, against the wall. These are the exercises you can ask them because it has to start with this. You cannot mobilize something that's not stable. I'm here, standing here. You tuck your chin in. Tuck your chin in. Yeah, then that's how it is. Relax here. Just tuck your chin in. Only your chin in. Yes. And you hold. No, stay there. Then you count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. You see, when you relax, you come back to your posture. But then this exercise, you can ask the patient to tuck your chin in to correct the posture. That's number one. Number two, because you know these muscles are too tight, you need to stretch them. The other exercise you do, you can do it here in the corner. You put your arms here, and then you go forward. So I'm stretching the forward muscles, which way rotated, causing the rotation. So you are stretching this one like this. You hold, this be sustained stretch. Can you do it? Your arms at the level of the shoulders. Make sure that here it's equal, and then you go forward. So you're stretching and you count. Stay there, don't go back. Just be sustained. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This for the pectorals, the major pectorals. But you need also to stretch the minor. For the minor, you lift higher. You get another stretch. The minor, pectoralis minor. You count, it has to be sustained stretch. And they do 10 seconds. So you can ask your patient to do it. For example, if they are working, they can do it at work every hour. They do it. Okay? You can sit here, facing there. Another exercise. Remember what we do. We are trying to recover the muscles which were stretched, shortened to get normal length, and then which were weak, like the deep neck flexors, to be strong. In this position, you want to stretch now these muscles, which are, first of all, is to correct your posture. Sit properly. Wherever you are, you need to correct your posture. Now, while you are sitting there, I want you to sit on your arm. One, any. And then with this other one, then you stretch. So when you do like that, you will be stretching these muscles. Sometimes you find a lot of trigger points here. You count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. And back. And change. Count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. So you can do it like 10 times, but all the time, number one is to correct your posture. When you correct your posture, you get that chin corrected. Okay? So you can start with this one, but remember, you can turn now and face me. When you look at this, stand down here. When you look at this scapula, they are winged. So it means we need to get them back on, because they are winged, they will develop that shortening in the front. So you need to get it fixed on this, on the thoracic cage. You see, so that you can correct the whole posture. So you can do exercises. You can sit now. I'm going to demonstrate, then you do it. You can use the Theraband to strengthen the Serratous anterior, which is weak. I put here on my scapula. If I want to use this arm, I'm here. I stabilize here, and I do the exercise. Move forward and back. 2, back. I'm not bending my elbow. 3, back. 4, back. I want to check at the back, my scapula, the way it's doing. It's moving forward. Can you see it? That's how it is. That's how it is. Yeah. So as a patient to do it. Let's say you are stabilizing here. No, stabilize here. It has to be stretched. Stretched. Hold here. Hold. Hold. Hold here. Are you holding it? Yeah, you resist. Now extend that other arm. Yeah, extend it fully. So what you're going to do is to reach and touch me there. Move and let it take you back. 2, that's it. 3, 4, 5, 6, 7, 8, 9, and 10. And you change, you come to this other one. So these are the exercises you can start with. Then slowly as the patient recover, they correct the posture, and the pain also will go away. Of course, you add pain modalities like tense, like it depends on the condition, tense or sometimes ultrasound when you have a lot of trigger points, which you need to have ultrasound sometimes. But if it is mostly neuro, use tense, especially when it's referring to, there's a referred pain that's going to the arms. Yeah, the other the exercise you need to do is to just stand up and face there, is to stabilize another stabilizer of the scapula is the inferior fibers of trapezius here that need to be strengthened. And of course we do Serratous anterior, the one we did, and you strengthen also inferior fibers of trapezius by going down and back. Okay? This is how you exercise it with Theraband, so that you can get these, they stabilize, and here they stabilize, which going to cause the correction in front. Yeah, so you can have a seat. So basically, I tried to do a general rehabilitation, also showing you the exercise you can ask your patient to do, because it's very important. Remember, it is to start with stability. As you will see them in the note, is longus colli, longus capitis. Very, very important. When we have a poking chin, it means they are weak. When you strengthen them, you correct the posture, and you correct the lordosis here, which sometimes causes compression on the disc, and disc prolapse causes on the nerves, and you end up by having the symptoms like tingling sensations, weakness in the arms. So postural syndromes are very common. So what we need to do as physios is to focus on correct exercise that need to be prescribed to the patient, but all will depend on the condition. But remember, for the patient to recover, the compliance on the exercise is very, very important. I always tell my patients about 70% of their recovery will depend on them, because you need to give them the right exercise. Sometimes they do the right, even when they practice sports. That's why you ask for sports. What kind of sports they do? What is the sleeping position? You see? So all that are very important when you assess your patient, so that you can advise. Sometimes in this kind of position, you may need to visit the offices to see how is the setup. Because you can correct it here, but when they go back, they have their setting, their machines on the one side. That's why they're using one side, and that side is going to deteriorate. Yeah, sleeping, as sleeping pattern I was saying, when you sleep on your stomach and you do it for many years, it's going to affect your neck. So these are the few, I think, treatment techniques I'm trying to demonstrate. And remember, one of the red flag that will prevent you from treating a cervical, it's the vertebrobasilar artery insufficiency. When you assess and you find that in their subjective, they say we feel dizzy, nauseous, and diplopia, it's not seeing double. Sometimes when you swallow, they feel pain. Then you need dysphagia also. They cannot talk. This artery also, they cannot talk properly or swallow properly. Then think of vertebrobasilar artery insufficiency. That patient, you cannot touch. You need to refer to the neurosurgeon, because sometimes they need to decompress the artery so that the brain can have enough blood. And if it is cervicogenic headaches, see first of all a physio. because they can treat you, and there's special techniques and special exercises for that. During this session, we cannot explore everything. I think let's stop here, then we will see now in the future if you can develop some other courses. Now that will be specific on every condition. Thank you very much.